WHO itself, the American Psychological Association, many other experts have also identified gambling disorder as a mental health issue. So sa tingin po ninyo, may sapat na bang appreciation yung ating bansa sa problema ng online gambling bilang public health concern? Na yun po yung diin talaga nung panukala ko, sir, for strict regulation.
Thank you, Mr. Chair, Ma'am Riza. In the Philippines, there is no concrete framework for responsible gambling. We hear about it a lot, that it's important that people should treat it responsibly or gamble responsibly. But as far as I know, there is no concrete framework for responsible gambling in the Philippines. There are these short snippets at the end of advertisements, or, by the way, gamble responsibly, but there is no concrete framework for it.
So just at the outset, napakalaking policy gap and consciousness gap para talagang ma-appreciate natin yung harms ng online gambling addiction sa ating mga kababayan, and should lead us paano sila mapoprotektahan at paano matutulungan. So I'll pursue that in my next round, Mr. Chair. Salamat po, Mr. Calleja. I think, Mr. Calleja, you started on this earlier, pero para sa kaalaman po ng lahat, ano po yung pagkakaiba ng gambling as a hobby, earlier you used the term entertainment, at saka yung compulsive gambling?
Mr. Chair, Ma'am Riza, so because just like with any addiction, you can be addicted to legal substances as well as illegal substances. Now, with gambling, it exists just like you can watch TV, you can watch YouTube, and you treat it as entertainment. There are some, however, who lean on it excessively and rely on it, and they become excessively preoccupied with it, that it distracts them from their responsibilities in life, sa family, sa work. So the healthy way to see gambling, as from a mental health standpoint, is as entertainment. But if it becomes a consuming activity, then it teeters on a very damaging behavior, and it results in social displacement and economic displacement.
At sa mga nakita po ng Bridges of Hope sa mga online gambling platforms, ano yung mga characteristics ng mga yon na nakakaengganyo talaga sa mga tao na paulit-ulit na sumugal hanggang naging health concern na nga po ito?
All right. Well, the abundance of promotion certainly attracts players. I think that's something that we see every day in our daily lives. But also the fact that it's very accessible. Alcohol is accessible. You can go to any 7-Eleven. Legal drugs are accessible if you have a prescription for it, but abuse it. Illegal drugs are harder to access, but people still get addicted to it. Now, with gambling, accessibility, ease of access is a very essential element of the addiction framework, no? The addiction formula. So if we're gonna limit access, I mean, I may be overstepping here, but accessibility, making it easy, gets more people in. I'm not gonna say it's gonna increase the damage, but I'm just gonna say that it increases the possibility of more people who cannot self-regulate participating in the gambling process. Not everyone has the insight or the discipline to know when it's already being damaging to themselves or to their loved ones. So that level of insight it can be taught, just like addiction can be treated, but to game responsibly is also something that has to be learned. No one knows that innately. There's no manual for it. So if you're going to promote responsible gambling, let's do it proactively rather than as a footnote at the end of an advertisement. It should be part and parcel of a company's responsibility. If the revenue is big, so too I feel should be their commitment to their customers and clients using their services responsibly, and so that they can remain productive without falling into the pit of addiction.
I think, Mr. Chair, that's one of the strongest messages that can come out of these hearings at yung pagsusumika po ng komite to pass a law. As the chair said, there are a couple of these bills na strict regulation tulad nung Sakit, and there are several that are for outright banning. But I think one of the strongest rationales is yung kasasabi nyo lang na if the revenue is big, and we know it's big, we're waiting for the reports, but we know it's big. Kaya nga natanong ko, in the tens of billions ba on the part of the e-wallets? And then Pagcor also reports big revenues. If the revenue is big, so should the commitment be. And it should be even bigger. Kasi sa ngayon, not addressed properly na or pa yung social harms. And sabi nyo rin, accessibility, ease of access is an essential element of addiction. So kung i-reverse natin yon, then an essential element of rehab or an essential element of public health approach should be, you are not overstepping. It should be to limit, reduce the accessibility, reduce the ease, make it more difficult. So my last question for this hearing, Mr. Chair, can you share, Mr. Calleja, any more of your experiences pagdating sa ating mga kababayan na mga Pilipinong naapektuhan nitong matinding gambling disorder at ano po yung tulong na kailangan nila?
Okay. I appreciate the question, Mr. Chair, Ma'am Risa. A lot of people who are involved in gambling addiction don't realize that they have a problem. And even if their families or their loved ones, their spouses realize that they have a problem, they don't know where to go. I go back again to the gamble responsibly message. It's just a message, but there's no call to action. The message is there, but they don't know where to go, who to email, what number to call. There was a mention that there was a hotline. Maybe that can be made more visible. 2 years ago, in Bridges of Hope, we have more than 15 branches across the country. No? Less than 10% were really involved in gambling. So now, today, this year, from January to August of this year, 7 out of 10 of our patient residents undergoing rehabilitation, addiction recovery treatment, are gambling related. This is based on our experience. So our treatments, of course, we're here to treat them. It's a manageable, treatable affliction. It's a medical condition. And rehabilitation centers such as us are accredited by the Department of Health. So we have a data-based treatment plan that we formulate. Now, most Filipinos, and I don't even know if I would say that most Filipinos don't know that gambling is an addiction that is treatable and manageable. Just like drug addiction is, just like alcoholism is treatable and manageable. Gambling addiction is treatable and manageable. But the rehabilitation concept in the Philippines is people think para siyang preso. Madumi, masikip, pangit ng pagkain. No? There is no shame in getting treatment for a medical condition like addiction. If you have a headache, you take paracetamol. If you break a bone in your arm, pinapakast yan, you go to an orthopedic surgeon. If there is someone with a problem with addiction, gambling addiction or other types of addiction, they can go to a medical professional and seek treatment as well.
Maraming salamat, Mr. Calleja. Again, that's a great lifeline that you've thrown out there. So, Mr. Chair, sana kung may nakikinig po sa ating mga hearings na kahit sinususpetsa niya na mayroon siyang gambling addiction or may family member na nakikinig na sabi niya, ay, si tatay or si nanay or si kapatid, baka may gambling addiction, help is here. No? There is help. You can start with DOH at yung mga accredited rehab centers nila, including Bridges of Hope and maybe yung binanggit din kanina ng Pagcor. So just as a last note, Mr. Chair, gusto ko lang i-stress yung sinabi na kapag may advertising at promotions, tulad ng tinatanong ko kanina sa PAGCOR, there is that increased possibility na sinabi ng Bridges of Hope of more people who can't self-regulate na maengganyo at posibleng malulong sa online gambling. So there's that potential harm na kailangan nating mapigilan na lalong kumalat at lalong tumindi. And lastly, yung observation nga ng Bridges of Hope na yung parang footnote natin na gamble responsibly, walang call to action. So I'm really looking forward, Mr. Chair, na yung committee natin sa committee report ay sa ating mga rekomendasyon, mas maraming calls to action ang mailalabas doon sa lahat ng stakeholders around the table. So maraming salamat po sa lahat ng resource persons. Maraming salamat po, Mr. Chair.